one of the important diagnoses for the patients who are suffering from an abdominal pain is the peptic ulcer disease. It is one of the major conditions that you'd usually come across, and you should know how to deal with these particular patients. Now, the major causative factors for the development of the peptic ulcer disease, it basically includes an H. pylori infection. So it's the foremost management, or it's the foremost investigation that you basically carry out for these patients. Carry out the H. pylori antibody test for these patients. If it is positive, if it comes positive, there's a particular regime that is present out there, and you'd be following out for that. Then we have the NSAIDs-related peptic ulcerations. So usually patients would give you a history of the multiple medications that he or she is taking. And that is basically, again, suggestive of the fact that it's the PUD that is developing according to the multiple medications that he or she is taking. Hypersecretory conditions, in which basically the cells of the gastric cells, basically, that are responsible for the secretion of the acid, the HCl secretion, they are basically hypersecreting, and that is again one of the conditions that is responsible for the peptic ulcer disease. And then we have an idiopathic ulcers, the unknown etiology for the development of ulcers. It can be the meals that the patient is taking, the kind of the lifestyle that the patient is having, or even stress is one of the major factors out there which can contribute towards the development of peptic ulcer disease. The differentials out there that we have to keep in mind are the gnawing pain that the patient would be having, a sensation of hunger all the time. The family history is very important, and it's very suggestive over here. And one of the things that you'll be focusing on history is the use of tobacco. So if he's a smoker, he's most likely to develop peptic ulceration. Melena, or blood in stool, is one of the symptomatology that the patient would be suffering from, and sometimes it is one of the associated feature that he or she is suffering from. The diagnostic tests for this particular patient would be an EGD that is performed, and endoscopic basically examination of the stomach and duodenum. The biopsies are also taken, and you also perform a monoclonal stool antigen for these patients to rule out any kind of chronic infections that he or she might be suffering from. Now, the treatment is going to depend upon the causative factors. The etiology has to be treated basically. If it's an H. pylori that is causing the peptic ulcer disease, you have to eradicate that through the particular regime. Then it can be a stop ulcer use, which it can be performed. We can have H2 blockers. If it's a hypersecretory phenomena, we can basically refer to the H2 blockers or the PPIs, which are given, and they usually are very helpful for the alleviation of the symptoms particularly. So you'd be looking for all of these factors, and the causative factors is what you'd be focusing on, and you'd be treating that. The underlying cause is treated, and the patient gives a very good prophylaxis in these particular cases.